All right, let's dive into vascular disorders today. You know those super important arteries and veins, the network that keeps your blood flowing?
Yeah, the unsung heroes until something goes wrong.
Right. And we've got a nursing textbook chapter, a detailed outline, and even a study guide. Seriously challenging questions in there.
Oh, yeah.
Whether you're a healthcare pro or just curious, get ready to learn about these conditions, their causes, symptoms, and treatments.
Oh, and some surprising facts. We'll talk about the 6PS, those signal a medical emergency, and, well, the interesting phenomenon of blue toe syndrome.
Okay, let's start with the basics. Atherosclerosis. It's a big word,
It is.
but a really important concept.
Atherosclerosis is like the foundation for a lot of vascular disorders. Think of it like a slow, gradual buildup of plaque inside your arteries. It's like a pipe slowly getting clogged.
And what exactly is plaque made of?
It's a mix of things: fats, cholesterol, and other substances that stick to the artery walls. Over time, this plaque narrows the arteries, restricting blood flow.
So it's like, when people talk about having clogged arteries in their heart.
Exactly. That's atherosclerosis. And it can happen in your legs, brain, really anywhere.
So not just a heart problem, whole body problem.
Right.
What's the biggest culprit behind this clogging?
Out of all the modifiable risk factors, smoking is the biggest. It contributes to both artery and vein problems.
Okay, so if you're listening and you smoke, quit. I know,
Uh-huh.
easier said than done. But seriously, one of the best things you can do for your vascular health.
Absolutely agree. But smoking's not the only villain. Diabetes, high blood pressure, high cholesterol, and just getting older all increase your risk of atherosclerosis.
Wow, that's a lot to consider. Makes me think about my own habits.
Never too early to think about prevention. Small changes can make a big difference.
So atherosclerosis is like the underlying condition, and then from that you can develop specific vascular disorders.
Exactly. And one we should definitely talk about is PA,
PA.
peripheral artery disease.
I've heard of it, but I don't really know much about it.
It's more common than people think. KD affects those arteries in your legs and feet, and it's often caused by, you guessed it, atherosclerosis. Imagine you're walking and your legs start to ache, cramp up, but then the pain goes away when you rest.
Wait, so that's not just me being out of shape.
Could be. That's the thing about PD. Symptoms can be subtle, but the key is that the pain comes on with activity and goes away with rest.
So like your leg muscles aren't getting enough blood flow when they need it.
Exactly.
Is there a way to test for PAD?
Absolutely. There's a simple test called the Ankle-Brachial Index, or ADI. We measure blood pressure in your ankle and compare it to the pressure in your arm. If the ratio is low, could mean there's reduced blood flow to your legs. Sign of PAD.
So pretty straightforward test. What happens if it's not diagnosed and treated?
Well, it can progress to something called critical limb ischemia, or CLI.
That sounds pretty intense.
It is. CLI is a severe stage of PAD where blood flow to the legs and feet is critically reduced. We're talking pain even at rest, non-healing wounds, and even gangrene.
Wow, that's scary. I see why catching PA early is so important.
It is. Without treatment, CLI can lead to amputation. Pay attention to those early warning signs and get checked out by your doctor if you have any concerns.
Okay, so atherosclerosis can lead to PA, and PA can progress to CLI if left untreated.
Got it. Now picture this. A sudden blockage in an artery, like a huge traffic jam cutting off vital supplies. That's what happens in acute arterial ischemic disorders.
Sounds intense. What causes that kind of sudden blockage?
Often it's a blood clot that travels from somewhere else, like the heart, and gets lodged in an artery, blocking blood flow.
So like a rogue clot causing chaos. What are the warning signs?
There's a mnemonic, the 6Ps.
Okay, lay 'em on me.
First, pain, often sudden and severe. Then pallor, where the skin turns pale from lack of blood flow. You'll also notice pulselessness, a weak or absent pulse below the blockage.
All right, that's 3. What are the other Ps?
Paresthesia, numbness or tingling in the affected limb. Then paralysis, you can't move the limb. And lastly, poikilothermia, the limb gets cold to the touch.
Wow, that's quite a list. I'm guessing if you have even a few of those, get to a doctor immediately.
You got it. Acute arterial ischemia is a medical emergency. Every second counts. Delaying treatment can mean losing a limb.
So far, we've covered atherosclerosis, PAD, CLI, and acute arterial ischemia. Ready for some less common vascular disorders.
Let's do it. I think you'll find these next two interesting.
Hit me with it.
All right, let's talk about Berger's disease and Raynaud's phenomenon.
Okay, those are definitely new ones for me. What makes them so fascinating?
They both disrupt blood flow, but in very different ways. Berger's disease is an inflammatory condition. It targets small and medium arteries and veins. And get this, it's almost exclusively seen in heavy tobacco users.
So that's not just cigarettes, right? Cigars, chewing tobacco, too.
Exactly. Any form of tobacco can increase your risk, and we're seeing it more in heavy marijuana users, too.
Really? That's interesting. Not something I would have guessed. What happens in Berger's disease?
Well, the inflammation causes those blood vessels to narrow and clot. Can lead to pain, numbness, even tissue damage. One striking symptom is blue toe syndrome. Tiny clots go to the toes and, well, turn them blue.
Ouch. That's a visual I won't forget. Okay, so that's Berger's disease. What about Raynaud's phenomenon?
Raynaud's is all about vasospasm. That's a sudden narrowing of the small arteries in your fingers and toes.
What triggers those?
Cold temperatures, stress spurts, those are the usual culprits. Imagine you're outside on a cold day and your fingers suddenly turn white and numb. That's classic Raynaud's.
So bundling up isn't just about comfort. It could be preventing a painful episode for someone with Raynaud's. Never thought about it that way.
Exactly, and it's more common in women than men.
Okay, so let's recap those color changes. You said the fingers or toes turn white first.
Right, from lack of blood flow. Then, as the vessels constrict more, they turn blue. And finally, as blood flow returns, they flush red.
Wow, pretty dramatic.
It can be, and it can be accompanied by pain, numbness, and tingling.
So Berger's disease and Raynaud's phenomenon, two very different conditions, but both highlight the importance of blood flow to those extremities. It's amazing how something like cold temperatures can trigger such a reaction in the body.
It is. And speaking of blood flow, let's shift our focus to the aorta, the biggest artery.
The aorta, I know it's the largest artery, but what kind of problems can happen there?
One of the most serious is an aortic aneurysm. That's a weak spot in the aorta's wall that balloons out.
So it's like a bulge in a tire, and that can burst.
Yes, there's a risk of rupture, which can be life-threatening.
Are all aneurysms the same?
Not exactly. We categorize them as true or false aneurysms. A true aneurysm involves all three layers of the artery wall, like a balloon expanding. A false aneurysm is a contained leak outside the artery wall, like a small pocket of blood next to the artery.
Okay, so a true aneurysm is a bulge in the artery itself, and a false aneurysm is more like a leak. Helpful distinction.
And then there's location. Thoracic aortic aneurysms, or TAAs, affect the chest part of the aorta. Abdominal aortic aneurysms, or AAAs, happen in the abdomen.
I've heard of AAAs. Are those more common?
Yes, much more common than TAAs.
So what should people be aware of when it comes to aneurysms?
Early detection is key. They can grow silently without any symptoms, then rupture suddenly. That's why regular checkups and imaging tests are so important.
I'm sensing a theme here. Early detection is so important for so many of these vascular disorders.
It really is. The earlier we catch these problems, the better the chance of successful treatment and preventing serious complications.
All right, let's say an aneurysm does rupture. What happens?
It's catastrophic. Imagine sudden, intense pain, often in the back or abdomen, and rapid blood loss. It's a medical emergency.
That's terrifying. What are the treatment options?
Surgery is the main approach. Open aneurysm repair involves opening the abdomen or chest and replacing the weak section of the aorta with a synthetic graft.
That sounds pretty invasive.
It is, but there's also endovascular aneurysm repair, or EVR.
That's going in through a smaller incision.
Exactly. With EVR, we insert a graft through a catheter in the groin, threaded up to the aneurysm. The graft reinforces the weak spot from the inside and prevents rupture.
So EVR is like an internal brace for the aorta. That's amazing.
It's a huge advancement. Aneurysms aren't the only problem in the aorta. We also have aortic dissection.
From what I've read, it sounds like a tear in the aorta's lining.
That's right. It's a split within the artery wall. And it's not a true aneurysm, even though people sometimes use the terms interchangeably.
What are the different types of aortic dissection?
We classify them by location. Type A dissections affect the ascending aorta, the section closest to the heart. Type B dissections involve the descending aorta, further down.
I'm guessing location makes a big difference in how urgent it is.
You're right. Type A dissections are surgical emergencies. They involve the section of the aorta under the most pressure. A rupture there can be fatal in minutes.
What about the symptoms? How would someone know?
The pain is usually excruciating, like a ripping or tearing sensation in the chest, back, or abdomen.
So sudden severe chest or back pain, get to the ER.
Right, absolutely. Better safe than sorry. Time is of the essence with aortic dissection.
Wow, we've covered so much ground. And we're just getting started. Let's take a breath and let everyone absorb all this information.
All right, welcome back to our deep dive on vascular disorders. Hope you all had a chance to catch your breath because we're about to explore the other side of the circulatory system, the veins.
Okay, veins. So far, we've been talking all about arteries and what can go wrong when those get blocked or damaged.
Yeah.
What about veins? What kinds of things happen there?
Well, veins are just as important as arteries, but they've got a different job. Their role is to carry that blood back to the heart after it's delivered oxygen and nutrients to all the body's tissues.
So like a return trip. The arteries deliver the goods, and the veins bring everything back.
Exactly. And when something goes wrong in the veins, it can lead to venous thromboembolism or VTE.
Okay, VTE. That sounds familiar. Remind me, what exactly is it?
VTE is actually an umbrella term that covers two main conditions: deep vein thrombosis, or DVT, and pulmonary embolism, or PE.
Okay, so DVT and PE are both types of VTE.
Right. With DVT, a blood clot forms in a deep vein, usually in the legs. And with PE, that clot breaks free and travels to the lungs, blocks blood flow.
So a DVT can turn into a PE. And if a clot is blocking blood flow to the lungs, that sounds pretty serious.
It is. PE can be life-threatening.
Okay, so let's break this down. What causes VTE in the first place?
It all comes down to something called Virchow's triad.
Ooh, a triad. I love a good medical mystery. What are the three elements here?
Basically, it outlines the three main factors that increase that risk of blood clot formation. First, we have venous stasis, which just means slow blood flow in the veins.
Okay, so what kinds of things cause that slow blood flow?
Think about those long flights where you're sitting for hours or being bedridden after surgery, even sitting at a desk all day without moving around much.
Guilty. Getting up to stretch right now.
Good. Keep that blood flowing. The second factor is endothelial damage, injury to the inner lining of the vein.
What causes that kind of damage?
Could be from trauma, surgery, even certain medications.
Okay, so that makes sense. Slow blood flow and damage to the vein walls. What's the third piece?
The third one is hypercoagulability. Basically means your blood has an increased tendency to clot.
So some people's blood is just naturally more likely to clot.
Exactly. It can be inherited conditions, certain medications like birth control pills, even dehydration.
Wow. So it's a combo of these three factors that sets the stage for VTE. That's fascinating and a little scary. So how do you know if you have a DVT? What are the signs?
DVT usually affects the leg, so look out for swelling, pain, warmth, and redness in the leg. The veins might look more prominent too.
Okay, so some pretty clear visual cues.
They can be, but sometimes there aren't any noticeable symptoms, which is why those risk factors we talked about are important.
And what about PE? What signs should people watch for?
This is where things get serious, fast. The most common symptom of a PE is sudden shortness of breath, can be quite severe.
That sounds terrifying.
It can be. Other red flags include chest pain, especially when you breathe in, coughing, maybe even coughing up blood, and a rapid heart rate.
Okay, so any of those, call 911.
Absolutely. PE is serious and needs immediate medical attention.
So how do doctors actually diagnose VTE?
Well, we start with a medical history, physical exam, and then we might order a blood test called a D-dimer, which can indicate if there's clotting going on.
And if that D-dimer test comes back positive, what's next?
Usually imaging tests like ultrasound or CT scans to really see where the clot is and how big it is.
That makes sense. So once a DVT or PE is diagnosed, how's it treated?
The main treatment for VTE is anticoagulation.
Anticoagulation. We talked about that with acute arterial ischemia.
That's right. Anticoagulants or blood thinners prevent the clot from growing and reduce the risk of it breaking off and traveling to the lungs.
What are the different types used for VTE?
Well, there are a few. We've got heparin, which is given by injection, and warfarin.
I've heard of warfarin. That's been around for a while, right?
It has. Warfarin's been used for decades. It's effective, but it requires monitoring with blood tests to ensure the dose is right.
Why is that monitoring so important with warfarin?
Well, if the dose is too high, there's a risk of bleeding, and if it's too low, it might not work.
So it's a delicate balance.
It is, and one of the challenges with warfarin is that a lot of things can affect how your body processes it. Diet, other meds you might be taking, even genetics.
So managing warfarin needs lots of communication with your doctor.
Absolutely. Now, we also have a newer class of oral anticoagulants called DOACs, which have some advantages over warfarin.
You mentioned those earlier. Those are the ones that don't need those regular blood tests, right?
Exactly. DOACs have become pretty popular because they're more convenient and have more predictable dosing.
Can you give us some examples of those DOACs? What are their names?
Sure. Some common ones are rivaroxaban, apixaban, edoxaban, and dabigatran. They all end in emiban, except dagatran.
Okay, so that's an easy way to remember. Seems like DOACs are a good option for people who need anticoagulation.
They can be, but it's important to remember they still have a risk of bleeding, just like any other blood thinner.
So even though they're easier to take, vigilance is still key.
Exactly. Always important to discuss risks and benefits with your doctor. Now, we talked about heparin and warfarin. What about those IVC filters I've heard about?
Ah, yes, IVC filters. Those sound pretty high-tech. What are they?
An IVC filter is a little device that's implanted into the inferior vena cava, the large vein that brings blood from your lower body back to the heart. It's kind of like a net that catches any blood clots that break loose before they can get to the lungs.
Wow, so it's a safety net for preventing KEs? Is that a common procedure?
Not really. Usually for patients who can't take blood thinners, maybe due to bleeding risk, or those who've had repeated blood clots despite meds.
That makes sense. Sounds like a last resort.
Right. Now, I want to talk about something that can develop after a DVT. Chronic venous insufficiency, or CVI.
Okay, CVI. So this isn't a blood clot itself, but a condition that can develop after you've had a DVT.
Exactly. With CVI, the valves in the veins of your legs get damaged, makes it harder for blood to flow back up to the heart. That causes pressure to build up in the veins, and fluid leaks into the surrounding tissues.
So think swollen ankles and legs.
That's a common one, but CVI can also lead to changes in skin color, texture. It might look darker or thick and leathery.
And venous leg ulcers, right? Those are a complication of CVI, aren't they?
Yes, venous leg ulcers are sores on the legs, usually around the ankles, painful, slow to heal, and can get infected. That's one reason why it's so important to manage CVI.
So how is CVI treated?
Well, compression therapy is a big part of treatment. That means wearing special stockings or bandages that support the veins and help blood flow.
I've seen those compression stockings. They can be kind of stylish now.
They've come a long way, and they work. We might also recommend leg elevation, exercise, and wound care if there are ulcers.
So a multi-pronged approach to manage CVI and prevent those ulcers.
Exactly. Right. If you see those symptoms, especially if they get worse, see your doctor.
Now, what about varicose veins? You know, those twisted, bulging veins we see on people's legs. Are those related to superficial vein thrombosis at all?
That's a good question. Varicose veins are different. They happen when valves in the veins get weak and allow blood to pool, stretching the veins.
I've heard pregnancy can cause them.
True. Pregnancy increases blood volume, which puts pressure on those veins.
Are they just a cosmetic thing, or can they cause problems?
Well, they are often thought of as just cosmetic, but they can cause discomfort, aching, swelling, and in some cases they can lead to more serious complications like ulcers or bleeding.
So if you're bothered by them, it's worth checking with your doctor.
Definitely. There are lots of treatment options from compression stockings to more involved procedures.
Good to know. Now, you said that varicose veins are different from superficial vein thrombosis. Is there any connection between the two?
Actually, yes. Varicose veins can increase the risk of superficial vein thrombosis.
Oh, really? Why is that?
Well, because the blood flow is slower in varicose veins, it creates an environment where clots are more likely to form. Remember, Virchow's triad. Slow blood flow is one of those key factors.
It all comes back to Virchow's triad. Amazing how those three factors play a role in so many vascular conditions.
It is. Now, before we move on, I want to touch on CLI again. Critical limb ischemia.
Right, CLI. The severe stage of PID that can lead to amputation.
Exactly. It requires aggressive management.
What are the options for treating it?
The main goal is restoring blood flow to the limb. That might mean surgery like bypass grafting or angioplasty.
Those have risks, right?
They do. And sometimes when we can't save the limb, amputation might be necessary.
That's a tough decision.
It is. It shows how important it is to detect and treat PID early.
Okay, so we've talked a lot about blood clots in the arteries and veins, and we talked about meds to treat them, anticoagulants, but we haven't really gotten into the specifics of those medications.
You're right. Anticoagulants are so important for treating and preventing clots, but they're also complex, need careful management.
So let's unpack the world of anticoagulants. What are the different kinds, and how do they work?
All right, let's start with warfarin. Brand name Coumadin. It's been around forever, and we still use it a lot.
And we talked about how it needs monitoring with blood tests.
Right. We monitor warfarin with a blood test called the INR. It measures how long it takes for blood to clot. Target INR is usually 2 to 3.
What happens if the INR is outside of that range?
If it's too high, higher risk of bleeding. Too low, the medication might not be preventing clots.
So finding that sweet spot.
Exactly. And so many things can affect INR diet, other meds, even genetics.
So lots of communication with your doctor is important.
Absolutely. Now let's talk about DOACs again. Direct oral anticoagulants.
Those are the ones that don't need regular blood tests.
Right. They've become really popular because of that and because they have more predictable dosing.
Remind me of some examples.
Rivaroxaban, apixaban, edoxaban, and dabigatran.
Okay. Akeban, except for dabigatran. I'm learning.
That's great. And while they don't need routine blood tests, DOACs still have the potential to cause bleeding.
So even though they're easier, still need to be careful.
For sure. Now let's talk about another type, heparin. Usually given by injection, often used in hospitals.
Why is that?
Heparin works fast, and it's easier to reverse its effects than warfarin if there's bleeding.
So when you need it to work quickly, like in an emergency.
That's right. And then there's low molecular weight heparin, or LMWH. That's a type of heparin that can be given by injection at home.
What are the advantages of that?
Well, LMWH lasts longer than regular heparin, so fewer injections. And it has a lower risk of a rare but serious side effect called heparin-induced thrombocytopenia.
So LMWH is more convenient and potentially safer for patients outside of the hospital.
Exactly. Now, one thing that often comes up with these meds is drug interactions.
I bet. These meds are powerful, so I imagine they might not mix well with everything.
That's right. Certain foods and supplements can interfere, too.
So tell your doctor everything you're taking.
Absolutely. Even over-the-counter drugs and herbal supplements.
Now, we've talked a lot about the bleeding risk with these meds. What are some signs someone should look out for?
It's important to be vigilant. Unusual bleeding should be checked out. Easy bruising, bleeding gums, nosebleeds, blood in your urine or stool.
Okay, so those are the obvious ones. What about the less obvious signs?
Sometimes bleeding can be internal. Things to watch for include bad headaches, dizziness, weakness, or abdominal pain.
Those sound like general symptoms that could be lots of things.
True. But if you're on blood thinners, these should be checked out by a doctor right away.
So it's all about context.
Exactly. Now, what happens if someone does have a bleeding complication while on an anticoagulant? What do we do?
I'm guessing that's where those reversal agents come in.
You got it. There are antidotes for some of these medications that can stop bleeding fast. Like vitamin K can reverse warfarin.
But what about the DOACs?
Some of them have reversal agents, like idarucizumab for dabigatran. But others don't have a specific antidote.
So in those cases, supportive care and monitoring are key.
Absolutely. It shows how important it is to choose the right anticoagulant for each patient.
Right. Weighing the benefits against the risks.
Exactly. Now, I want to go back to aortic surgery for a minute. There's a specific complication we haven't talked about. Spinal cord ischemia.
Spinal cord ischemia. That sounds serious.
It is. During aortic surgery, especially when it involves the descending aorta, there's a risk of interrupting blood flow to the spinal cord.
And that can lead to...
paralysis.
Wow, that's a serious complication. How often does that happen?
Thankfully, it's pretty rare now because of advancements in surgery and monitoring, but it's still a risk.
Absolutely. Shows how complex aortic surgery is.
Well said. This leads us perfectly into our last section, where we'll wrap things up and talk about how vascular disorders affect people's lives.
Wow, what a journey this has been. Exploring the circulatory system, arteries and veins. It's amazing how much we've learned.
I know, right? We've gone from common conditions like PAD and DVT to the rarer ones, Berger's disease and aortic dissection.
And we talked about prevention, recognizing those warning signs, managing these conditions. Especially those anticoagulants. Those are powerful.
This definitely highlights how connected our vascular health is to, just how healthy we are overall.
Absolutely. And you know what we haven't really talked about? How vascular disorders affect your quality of life.
That's such an important point. It's not just physical symptoms. It affects you mentally and emotionally, too.
Oh, for sure. Imagine the anxiety of an aneurysm could rupture anytime. Or a severe PAD where you can't even walk without pain.
And the chronic pain that comes with CVI, that can really get to you after a while.
It's so important to recognize that, to make sure patients and families have the support they need. It's not just about treating the physical part, it's about the whole person.
100%. Now, as we wrap this up, I want to leave everyone with something to think about.
Ooh, I like it. Hit us with that final thought-provoking question.
So, given everything we've talked about, how connected vascular health is to your well-being, what's one small thing you can do today to improve your own heart health?
That's a great question. Could be going for a walk, choosing a healthier meal, or even quitting smoking.
Exactly. Every little bit helps. And remember, The more you know about your vascular system and how to keep it healthy, the better you can take care of yourself.
Well said. What an incredible exploration of vascular disorders.
Yeah.
Thanks for joining us on this deep dive. Hope you learned a lot and feel empowered to take charge of your health.
Absolutely. It's been my pleasure sharing this with you. Until next time, stay curious and stay healthy.